Good afternoon, ladies and gentlemen, members of the media present here with us, those of you at home and elsewhere and abroad following us on your various platforms. Welcome to our weekend program of reporting on how we are going with the COVID-19 response. Today I will start with the same format we did last week. I'll ask Dr. Parasuram, CMO, to give us his data, and his team would follow through from that.
Good afternoon. Thanks, Honorable Prime Minister, Honorable Ministers, members of the media, members of the viewing and listening public, colleagues. So the update for 11th of June at 4 p.m., total persons tested to date, 206,150 new positives over the last 24 hours are standing at 300, giving our total to date from 12th of March 2020 to present, 28,106. Total recovered patients stand at 18,009. The active cases, you would note, has been declining over the last couple of weeks, so now stands at 9,453. Total patients in hospital holding steady, and Dr. Richards will go into detail, 441. Total has stepped down 175. Those in quarantine 152, and persons in home isolation 8,537. The vaccinated persons were first dose 150,213, and totally vaccinated with their second dose 9,496. Dr. Hines will go as usual into the EPI update, followed by Dr. Richards and then Dr. Trotman. Dr. Hines?
Thank you, CMO, Honorable Prime Minister, Honorable Ministers, colleagues, members of the media, members of the viewing and listening public. The EPI update for this week is as follows. Looking at the epidemic curve, what we note is that continued slow but hopefully steady downward trend in the numbers of cases that are attributed to being swabbed on each day. This curve shows the number of positives by the date of swabbing, and it may disaggregate any clustering that may happen as a result of batching, etc., so that we see a better distribution of the cases when they would have appeared in the population. And this shows that the blue section over to the right, representing the cases for the month of June so far, the heights of those bars are a little lower than the gold section just before it, which was the color assigned to the month of May. Highest point being somewhere in the middle of May, that midweek of May, that week 3 of May being the highest point to date. If we aggregate these figures to a weekly as opposed to a daily, taking out some of those daily fluctuations, you get a better picture of the upward trend that we saw from basically the end of February, start of March, all the way through to the end of May. The colors representing different months, green, blue, orange, purple, etc. And we did see that week on week, from one bar to the next, there was a steady increase up to the week 21. The increase was pretty small between week 20 and week 21, being only about 0.3%. And then as we moved into week 22, which was really the first week of June, we saw that there was a decrease of about 10% when you get the total aggregated numbers for the week, for week 22. For week 23, the preliminary figures coming in for today to end week 23 is just a little over 300, about 316. So we are going to have approximately 2,230 total, which would be a 30% decrease compared to the week before. And we're hoping that this week-on-week decreasing trend is the trend that continues to manifest itself going forward. Looking at it on a monthly basis, and then backtracking for a moment to the weekly, we see that the salmon-colored section shows that for the month of June so far, the overall positivity has been around 35, 36, but that has been a decreasing trend over the last couple of months. Sorry, last couple of weeks. Last couple of weeks showing a decrease from 43 to 37. So we're seeing where the total number of positives coming out of every 100 samples is now decreasing from 43% down to about 35% at this point in time. Looking at the demographics have been relatively consistent. just about 50% with males and females, largest section being in that mobile working age group, around 53%, and the under 18s being a constricted portion of that pyramid, a smaller number, as they've been largely kept out of circulation for the vast majority of the pandemic by being kept out of schools physically, etc., so that the risk to them was diminished, and that has shown itself in the age distribution that we see with these positives. With the deaths, we see that that swing towards slightly more female patients among the fatalities has just about stabilized, whereas we were around 3/4 or 75% men. We're now down to about 60% men and 40% women, still with the majority in the over 60 age group. Looking at how the projections versus the actual figures compare, we see that the original projection, looking at the speed we're going at the end of April, that green line that moves very steeply upwards, we've moved pretty far away from that. We recalculated, looked at where we were going, the rate we were going at, just before the SOE restrictions would have begun to have their own effects, but after some of the other restrictions would have had their effects. So that orange line, that orange curve that still goes upwards moderately steeply, that curve was what was happening before the SOE began to take effect. The blue bars, that blue section that curves downwards a little bit away from the orange line, that's where we are. So we do see that there has been a continuing slowing, not rapid, but a continual slowing as time has gone forward with the various restrictions beginning to bear fruit. If we look at it in terms of the speed at which we were doubling, meaning accumulating as many cases as in a previous time frame, the last time we'd had a full doubling was around the 16th of May. We thought at the speeds we were going at, it may happen on the 7th of June, but we slowed enough for that not to happen. We thought again we may reach that next doubling landmark by the 14th. The 14th is the day after tomorrow. And at this rate, we will again not have reached that. So we're seeing that that braking force, that slowing, continues to manifest itself. And if you look at the number of active cases, the actual active cases being that green line, we see what the CMO pointed out, that it's sort of plateaued and now begun to hold steady, is now beginning to come down a bit, as opposed to the projected course, which was the dotted line that we were expecting to move along if we continue to accumulate active cases as we were doing at the end of April. The dotted line would be even more steep if we had actually used calculations from the month of May when we had that bigger surge. So we have seen where, again, the change in trajectory, slowing of the numbers of new cases and accumulation of active cases is manifesting itself day by day, week by week, and it is encouragement to continue doing what we're doing, because the numbers are still not small, but the numbers are decreasing. So we need to make sure that we continue doing what we're doing to continue that braking force and slowing of the epidemic at this point in time. I'll now turn you over to Dr. Richards for the detailed hospital figures.
Thank you very much, Dr. Hines. Good afternoon to the Honorable Prime Minister, the Honorable Ministers of Health, Energy, and the Office of the Prime Minister. Good afternoon to my medical team, the members of the media, members of the viewing and listening population of Trinidad and Tobago. Once again, thank you very much for joining us at this afternoon's press conference. This afternoon, I would like to provide a brief update on the status of the hospitals within the parallel healthcare system. And at present, we have 16 activated centers in the parallel healthcare system to take care of confirmed COVID-positive patients. As Dr. Hines would have demonstrated in his earlier presentation, the rolling average continues to decrease slowly but steadily. And we report dailies, but of course, we like to present the rolling average, which is somewhere in the vicinity of 329 as of today, because it gives us an idea of trends that we would have seen over a 7-day period. Of course, the average number of cases is a bit of a predictor for the need for hospital beds, given the number of confirmed cases that we have. This graph demonstrates the number of admissions and discharges against the number of daily new cases. And over the last week, we would have seen that there was a slight widening of that gap between the admissions and discharges. And I'll go in a bit more detail in the next slide to discuss this trend. Now, the net admissions per day that we have been looking at really represent the difference between persons who are admitted at a hospital and the persons who are discharged. And we use this figure to really look at the capacity of the system and to care for patients. Now, over the past few weeks, and I'll move on to the next slide, the number of persons being admitted has remained fairly constant. The average number of persons admitted per day at our hospitals has been between 66 and 72. However, last week we saw a decline in the number of persons on average that were being discharged, and that decreased from about 51, 56, and then down to 46. Now, this resulted in an increase in the overall net admissions of 26. And really what happened here is that there were more ill patients, because if a patient requires a longer or more critical care, they would spend more time in hospital. Of course, we have been indicating that the average length of stay for a COVID patient can be anywhere between 5 days and 21 days, somewhere in the vicinity of 12 days, depending on how ill they are. However, what I'd like to emphasize to the population is that despite that increase in the net number of admissions or net cases per day, the capacity of the parallel healthcare system, of course, has been increased significantly. So these patients are being managed with additional beds that we have, for example, at the St. James Medical Complex and at the field hospitals. This line graph demonstrates the total number of patients who are receiving care on a daily basis. So this is an actual number, not an occupancy number. And we can note that as of the 22nd of May on or around, the numbers have fairly plateaued, with a total number of patients within the parallel healthcare system somewhere in the vicinity of between 610 and 625. Again, we've seen a plateauing effect over the last week. This graph demonstrates the occupancy levels, and of course the occupancy levels really speaks to the capacity of the parallel healthcare system to manage patients. And again, we saw initially a decline, and now we are seeing a plateauing in terms of the occupancy. Now, the occupancy levels again speak to the level of care that a patient requires. So if we have persons who are very ill and require a longer stay in hospital, they won't be discharged as quickly. Now, what we've noticed is that the occupancy levels overall in Trinidad and Tobago are in the vicinity of about 60%. That has remained constant. For Trinidad, it's slightly higher at 63%, but we are still well under the danger zone of 75%. This graph looks at the occupancy at the hospitals that take care of our most ill patients. And those are the hospitals that require the most resources, the most ventilators, nurses, doctors, and medication to take care of a patient. We've seen a slight increase in the total number of hospitals as opposed to last week that have crossed the 75% threshold limit, and that really is representative of the level of care for those patients. That is, over the last week, there were a lot more sick patients in the hospitals in our parallel healthcare system than the previous week, and they are spending a little bit of a longer time. As far as the step-down facilities are concerned, of all the step-down facilities, only one, which is the area hospital Point Fortin, was above the 75% threshold. So we are seeing patients being discharged and going home in a much shorter space of time from these step-down facilities. The ward level, which was the most critical sort of factor in terms of beds, was plateauing. It was decreased when we added additional beds, and now there has been a plateauing effect over the last week, which ties into all the other trends that we have been seeing. Now, this graph really speaks to the status of the accidents and emergencies, and we would all notice that there has been a general decrease in the number of confirmed COVID-positive patients presenting to the accidents and emergencies, which shows that there are less sick or less ill people in the community entering the A&Es. Also, it demonstrates that persons are being transferred into the hospitals and step-downs into the parallel healthcare system. And for the first time since the 24th of May or so, we are actually seeing some level of stabilization and plateauing. It is important to note that we are seeing a generally marked decline, especially out of the SWRHA, which is our largest RHA and has been having less than 10 persons or so in the A&E at any one point in time that are confirmed COVID positive, awaiting transfer. The picture is, or this trend is also correlated with respect to the ambulance services, which are another supporting factor. The ambulance service levels have generally dropped under 40%, anywhere between 30 and 40% of transfers for COVID transport, whether between hospitals or whether from home to a hospital accident and emergency. And again, the average turnaround time on the ambulances has correspondingly decreased. We are now seeing a plateauing or flattening off in the vicinity of around 2 hours, just over 2 hours, to have a patient transferred and turned around at an accident and emergency. Ladies and gentlemen, we are seeing some steadying, and there's a level of plateauing that's been noted within the parallel healthcare system over the last week. And this is a consistent trend that we have noticed over the last 2 weeks. Let us not be comforted too quickly or prematurely by this trend. Let us please continue to ensure the resilience and the protection of the parallel healthcare system, as well as the traditional healthcare system, by practicing the 3 W's. Let us continue to wash our hands, let us continue to wear our masks, and let us continue to watch our distance. We are confident at the Ministry of Health that if we continue to apply these COVID-19 prevention measures, we are confident and hopeful that we will be able to get these numbers down and win this battle against COVID-19. Thank you very much. Now on to Dr. Trotman.
Honorable Prime Minister, Ministers, CMO, colleagues, my fellow team members, healthcare members, inclusive of those that we often forget, our attendants who help us move around the hospital, our wards maids, our cleaners, our nurses, our doctors, and some others support staff that help get all the tests done, lab tests, radiographers, and so on. Thank you for your assistance. And that's only to mention some of the healthcare team. The members of the listening and viewing public, members of the media. I have a big job today. It comes for me after you hearing all of what appears to be such good news. I am here to remind you of the fact that we still need to keep our guard up. And to remind you also about the way that the COVID-19 vaccines work. It's not immediate. When you get a jab in your hand, the vaccines do not work immediately. They're great. At the beginning of this fight, we didn't have them, and we're very happy to have them. But what it helps us do is for the body to recognize when it's presented with this enemy to fight. And to do that, it has to build up the antibodies. And that takes time. And it takes weeks, not days. And for the vaccines that we have, it comes after 2 doses. So while we're waiting, I am imploring another critical part of the healthcare team, the public. You are a part of this healthcare team. To remember that you have to continue with the foundation. You must continue with the foundation. The other thing I want to just briefly mention is about some care at home. As you know, we have thousands of people who are well enough, even though they have COVID-19, to be at home. So some things, what can I do to help someone who's at home? Well, of course, remember that if they are home with you, you have to remember your isolation practices that we've talked about. That being said, you want to also emphasize the need for some basic things. Water is life. Hydrate. Drink lots of water. Put in reminders, as I do, to help say drink water. We're talking about drinking at least 2 to 3 liters of water if possible, unless your medical condition dictate otherwise, because sometimes that can happen, to drink lots of water. The big word for us is hydrate, because what we are seeing is some of our patients are presenting to the hospital and they're dry. We call that dehydration, because they have not drunk a lot of water. And there are serious complications that come from that. That may not directly be COVID, but because of the fact that you just simply didn't drink water. Drink your water. The other big thing is the usual Panadol, what we call antipyretics, are available, basic. Use those. And as much as you have a fever, then you can use your basic antipyretics for that. Simple signs to look for. If a person has difficulty breathing, I can't catch my breath. You notice they can't complete a sentence when they talk. So in between they take a breath. That's the quick sign that something could be wrong. Normally they're up, they're awake, but you find it's easy for them to fall asleep. They can't keep up as much as possible. And often in the elderly, confusion. They're confused. Or they're not eating as much. Those are signs that you need additional help. Reach out through the lines that we have, in the cases where relevant to your CMOHs, or if necessary, to our ambulance service and other support service to get help for those patients. So there are things that we can all do. And most important is when you do get called for your vaccine, please go for it when you're called. And while we're doing all of that, remember the 3 W's. Wash your hands properly. Wear your masks properly. Watch your distance properly. Thank you.
Thank you very much, Dr. Chotman and Dr. Parasram, Dr. Richards, and Dr. Hines. Ladies and gentlemen, I could not begin to speak to you today without going back to last Saturday and last Wednesday. Last Saturday, I spoke to you here about how we were going to manage through June and July. And it was all based on our understanding, appreciation, and confirmation of availability of vaccines. Because we are in the situation now of attempting to vaccinate the population. And everybody knows that that is the best thing that we could do now with respect to trying to improve our circumstances. And we did outline and did in fact have a good weekend on Saturday, working with the private sector. And I think everybody was buoyed up by the fact that we did get something done well, and there were people being vaccinated, and we were preparing to come back out cautiously with our economic activities. But there was a problem with respect to reaching out to the larger, wider population. And that problem was the communication system between those who needed to be vaccinated and those who were in fact doing the vaccination. As head of the government, I take responsibility for how the government goes about its business. And this is part of the government's business, and I take responsibility for that, as I told you. And I want to tell the country again, notwithstanding any flare-ups or any advice coming from any quarter, I'm in this for the long haul. And I intend to see the country through to a place of safe landing on this. So I'm not going to be distracted by any intermittent failure, nor unreasonable expectation or responses. But Wednesday was a bad day. It was a bad day in that The government, through its agency, through its prime minister, its minister, its infrastructure, tried to do too much with too little. It was a bad idea to try to solve the problem of the registration program not reaching everyone who wanted to be registered by simply removing that stricture of a registration and replacing it with what one can call now a mass vaccination exercise. We are in no position to carry on mass vaccination, and therefore that experiment of trying to do too much with too little could only have failed, and it has failed, and we acknowledge that. And I, as Prime Minister, unreservedly apologize to those who sought to work within that program and did in fact experience what was the bad day of Wednesday. This has nothing to do with the technical staff. It has nothing to do with the ability of the technical staff to provide us with clinical and scientific information about the virus. This was solely at the level of the government as to how we try to do as much as we can, as quickly as we can. And of all the things that we tried to do, this one did not work. So, ladies and gentlemen, you've already had an apology from the minister responsible for the portfolio, and you now have an apology, an unreserved apology from me, particularly to those elderly people who did in fact come out thinking that they could put themselves through the probably pain and certainly the inconvenience and disappointment of coming out and not being able to receive the vaccine. But I'll come back to our situation on that a little later on. But ladies and gentlemen, let us not throw the baby out with the bathwater. We have been doing reasonably well. In fact, we've been doing quite well. And we want to be able to go back to where we were doing well, like what we did on Saturday, and to come to a place where we can make the most of what is available to us in the most successful and effective way. The Ministry of Health, the Minister of Health, the government has had an opportunity to revisit the situation, and later on the Minister will tell you how we will ensure that that does not happen again, and that we, going forward, will be in control of a situation to ensure that whatever vaccines we have get to those in greatest need, and also in a way that utilizes our best infrastructure, human and physical. Ladies and gentlemen, I want to indicate to you that the vaccination program in Trinidad and Tobago is as good as, and probably better than, most, certainly in the CARICOM and worldwide. And for that basis, I want to bring you up to date on where we at as a member of CARICOM. I brought a table here to show you what our position is. And I would ask you to look at the third column, which says total vaccines received by country. And there are 14 CARICOM countries there and 5 CARICOM associates. Of the 14 CARICOM countries, the only country in CARICOM that has received into its borders more vaccines than Trinidad and Tobago is Guyana. And the reason for that is that Guyana took a decision which we did not take. I've raised that at this platform before, but I'll raise it again. The Guyana government took a decision that Trinidad and Tobago did not take, and that is, early in the proceedings, to use vaccines that were not approved by the World Health Organization. As a result of that, Guyana had a larger volume of vaccines available. We did not participate in that, and that explains it. So if one is looking at WHO-approved vaccines, it would be clear that Trinidad and Tobago got within its border more vaccines than any other CARICOM country. And that includes Jamaica, that has twice the population of Trinidad and Tobago. If you look, you see Trinidad and Tobago, this data is a couple days old. We got within our border 234,700 vaccines. Jamaica would have got 194,600 and Guyana 287,400. But an interesting thing is that you would have heard us saying that we got vaccines from some of our CARICOM colleagues. Reason being, these vaccines have a use-by date. They will expire by a particular time. We got vaccines from Grenada and St. Vincent. If you look at St. Vincent, with a population of 101,000, would have got 87,000 vaccines with a utilization of only 20,000. So by the end of this month, next few days, if those other vaccines were not utilized, they would have had to be dumped. And it's against that background, working with our CARICOM colleagues on a day-by-day basis, we were able to extract from them what would certainly have been underutilized and wasted and forms part of Trinidad and Tobago's vaccination units. And the same thing with Grenada. You would see Grenada got 136,000. They've only used 27,000. And therefore, we could have got some of those before they became wasted. And of course, if you see Barbados, which has a fairly high level of vaccination, 100,000 of those units in Barbados were units which Barbados received and accepted before they were WHO approved. So outside of that, if you remove that from the scene, you would see that Barbados would be in league with the rest of the CARICOM. And of course, Dominica was the same situation. If you look down below at the associated territories, Anguilla is the best vaccinated island in the Caribbean. But Anguilla is a British colony with only 15,000 people, and they got 20,000 vaccines. Bermuda, population of 62,000, they got 89,000 vaccines. British Virgin Islands, 30,000, they got 38,000. And Cayman Islands with 61,000, they got 88,000. And you will see that Cayman Islands and Bermuda would have vaccinated over 100% of their population. You might ask, how is that possible? It is because these territories have a lot of people present there who are not listed as part of their standing population. They are like either visitors or long-term visitors, but they had to be vaccinated. And they got their vaccines from the British government, which is like the United States and a couple other countries where vaccine availability is not the problem. So these small CARICOM populations in these small islands, they were participating in a situation where they never had a vaccine availability problem. But Trinidad and Tobago, Jamaica, and others, we still have a vaccine availability problem. And that is why when we identified what vaccines we had in hand, it wasn't a good idea to go to a situation of saying, okay, since the system of registering is slow for some people and is not working the way they would like it to work, let us remove that and then have a first come, first serve arrangement. It was a genuine attempt that first come, unimpeded, would have got those people vaccinated. But of course, the demonstration of a tremendous requirement as contrasted with vaccine hesitancy came upon us on that idea and made the idea completely unworkable and unusable. And of course, it is not to be repeated. And the reason why it wouldn't be repeated unless something drastically happened is that even though I told you last week, because last week Saturday I think it was, when I told you that we had made significant payments to lock ourselves into large volumes of vaccines. The African Trust arrangement, where we are paid in, we've made our initial payments and hooked ourselves into 800,000 vaccines of the Johnson & Johnson variety, which is one vaccine, one shot, one person. From revelations of what is going on with supply, I could tell you now that it is the view of the government that we are not at any time in the very near future going to receive a truckload of a boatload of vaccines so that we could go to mass vaccination. What is more than likely going to happen is that we're going to have a steady stream of quantities that we will have to manage. And that management would not be mass vaccination where you come to sites and be vaccinated in the way you thought might have gone, supposed to happen last Wednesday. It will be that we are going to focus, governed by the amount of vaccines we have in hand and available to us, and vaccines either on the water or in the air are available to us, that we will segment the population on an ongoing basis, and the minister will go into a bit more detail on that after, so that we do not invite you out for vaccines that we don't have, or we don't invite you out to crowd for vaccines that we don't have, and even if we have it, we shouldn't be inviting you out to come and be a crowd for vaccines. It has to be done better, where if we do have vaccines and you have to come out in larger numbers, that we do what others would have done, come out and get it. But because of the anxiety that exists in the population to be vaccinated, if we are coming out in large numbers, it has to be long lines, because you have to be spaced out. We all can't be in front of the door, and it can't be in a small building and the building is full. And of course, it makes more sense, we all shouldn't go there on the same day. So those are things that the ministry will review and reconstruct a platform to deal with intermittent arrivals of significant volumes, but not volumes that could generate mass vaccination. And I want to make that very clear to the country. And I want to, in so doing, acknowledge that Wednesday did not go well. But we are not going to throw in the towel because one day in a year and a half didn't go well. I'm confident that the future days will go very well. As I speak to you now, a shipment of vaccines are on their way to us and should get here by Monday afternoon. 200,000 Sinopharm vaccines should be within our control, and by Wednesday, those vials should be opened. So even that amount coming in on Monday does not allow us to go to a mass vaccination arrangement. It's just not enough. So we have to set priorities. And of course, we've done that, and the minister will talk to that in a little more detail. But it's not a one-dimension priority. The priority is saving lives and saving livelihoods. The cooperation with the private sector is largely working on the side of the saving the livelihoods. The call out to the general public who is anxious at home to get the vaccine for the individual safety is the saving lives side. So we are going to manage the inflow of the vaccines as we get them within those two ambits. The saving lives arrangement, dealing with people who are not having to come out specifically to go to work, and those people who need to be out to restart the economy, they have to be vaccinated as well. But we don't have enough vaccines to cover with a blanket everybody. So we have to make the best use of what we have so as to get, at the earliest opportunity, people coming out to work, and at the same time providing protection for the most vulnerable. And that is what we'll be doing as we go forward. I did mention that the acceptance of vaccines in some of our neighboring territories were such that we got some from people who were not going to be able to use them. We did get some from Grenada, from Bermuda. We did get some from St. Vincent, and from Grenada. We are getting another, or we've got them already? Yes, yes. We've got an additional 8,000 from Grenada, and we got an additional 5,500 from St. Vincent. These are items that will have gone, they would have gone to expiration if they are not utilized in the next few days. And we are very grateful for that, and that's an extra 13,000 vaccines. And the ministers factor that into what we'll be doing. So if we look at the month of June, you would see that the vaccination program is largely a program of the second dosing. And that is on the way, and the Minister will give details on that going forward, and that will go into July. July, we expect to be affected by the incoming Monday. We still don't have a confirmation as to when in July the hope of another COVAX shipment will come. We hope that that becomes part of the conversation in the next week or two, a COVAX shipment. And of course, we are looking to August, and is now towards the end of August when we can begin to anticipate shipments from the African Trust that we've paid into. You would have heard a lot being said about vaccines being made available from the United States offer. A lot of that so far has been conversational. There has been no release of any of those vaccines to come to any of us. And what is worse, you would have seen confirmation of a withdrawal of 60 million doses from the Baltimore plant, same Johnson & Johnson vaccine, which initially was being thought of as candidates for the first allocations. As I speak to you now, I could confirm to you, I have been in conversations with a lot of people in this matter. The final approval for movement of the doses have not yet come. And for those of you who are following what is being said, the 500 million vaccines that are to be made available by the United States, which is being part of the news from the G7, it carries with it the phrasing of within the next 2 years. Understand that? We in Trinidad and Tobago, we don't expect to sit here and wait for a year or two to get vaccines. We are doing the opposite. Where we can get vaccines to vaccinate us at the earliest, that's what we are doing, hoping that we be joined along the way by any other availability. And if by the time we vaccinated 600 or 800,000 people in this country, we would think that we have done extremely well. And it appears as though by the time we would have done that, we would not have got any significant inflows from those conversations. Because when you look at the numbers and the number of arms that are waiting for the numbers that are offered, it is still an infinitesimally small amount. 500 million, yes, sounds like a good number. But how many people are out there waiting for vaccines? In Africa alone, that 500 million would be lost because of the number of millions of people who would be relying on that. We, in Trinidad and Tobago, if we get deliveries on the commitments that we have, August into September, we're still on track with that. But we need, and we will be, tightening up on our management of what we have in hand now, we'll be having in hand in the very near future. And in the event that we do not get additional vaccines, the most we can say to you is to hold in place, hold on, we're coming to you. And that is what really should have been said to those people who could not get onto the call-in registration program rather than risk an attempt to say, come and I'll see if I can get you done. But let's be reasonable. It's not fatal. It's been an inconvenience. Some people call it disrespectful. I don't think so. Trying to help and failing is not disrespect. It is trying to do the best you can. We aim for the clouds. We got tangled in the treetops. We're a little bit above the ground because we are staying on the job to make sure that whatever vaccines we are able to put our hands on, that those vaccines are utilized in the best possible way with the least inconvenience. I want you to pay that diagram I showed you a while ago. You would have noticed that Haiti is a member of CARICOM. Haiti is the most populous CARICOM country. Has 11 million people. They have not vaccinated one person there. I don't know how many times we have to tell Haiti we're sorry, but this is one of those times. And of course, we will continue to work very closely with our CARICOM colleagues, and to the extent that they are able to go further with what they have, we stand with them. And as I said, there's a commitment from us that in the event that the ones that we're working with, if they do find themselves in a situation where we have to reciprocate as quickly as we could with what we have, I've given that commitment to them that we will be standing there with them, because this is a community effort in CARICOM, and this is where we're all in it together. With respect to coming out from the lockdown that we are in, I must admit that I was hoping that at this time we would have been a little further along the way down from the peaks of May. But we have to be realistic and we have to be careful. We have to be cautious. One of the worst things that could happen is to do it too early and discover that you've done it too early. The report we got today from Dr. Hines, Dr. Richards, and Dr. Parasram in particular tell us that we are going in the right direction, but not fast enough. But it's a good place to be as compared to where we were at the peak. Because if that peak had continued undisturbed, today we would have been reporting something quite horrendous and quite frightening. What we're reporting today is that we are making progress, but we need to make more progress before we take coming out actions and then discover that we've done it too early and reverse the gains that we've made in the last 3 weeks. So, fellow citizens, I'm calling on you again to stay the course. We, a few weeks ago, had Dr. Richards telling us that our hospitals were at peak and that was the most dangerous place to be. Thankfully, the report we got from her today is that we are below the most worrisome levels, and we are middling and plateauing below the panic stations. And we need to be grateful for that. That's the first and most important part of the responses we were looking for. And of course, with the information from Dr. Hines, you would have seen, yes, we go in June in a certain direction, but the numbers are still high. We need to be having lower numbers than that before we could confidently come out and say we can restart. I was hoping today to tell you that we would restart construction on Monday. I could do it, but it would be going against what we have learned and what we know, so I will not do it. I will ask you to hold on, and it appears from what we are doing and the trend that we are taking that we will require construction to remain idle for another possibly 2 weeks. And hopefully, when we come out at that time, we'll be on a much stronger foundation to not be easily exposed to a reversal of our circumstance. It means that the construction workers would be deprived of the opportunity of a pay packet for the next fortnight. And I will ask the Minister of Finance to see what assistance, if they are not already on the assistance program, what assistance we can give. And the program that we set about, the assistance program that was earmarked for May, would now apply to June. We just have to find the resources to provide that help to those who need it most, because without that, if we come out too soon, satisfy ourselves too soon, we could very quickly find ourselves dealing with the problem that we were dealing with in late April into May. And that's the last thing we want. So that is what I want to say to you today, and I hope that you appreciate where we are. There's one other CARICOM slide I brought which I wanted to show you. The other one, there's another, oh, it's there, yeah. This is how the CARICOM countries measure up. There are 4 bars there, I think 3. The last one wasn't printed. But the population is the blue one. You see that's where Jamaica is there, as compared to Trinidad and Tobago. That's the number of people around there, Jamaica, Trinidad and Tobago, Guyana, the blue bar. The orange bar is the total vaccines received by countries. And if you look at that across the board, you see basically there isn't very much difference, but you'll see how it stacks up against the populations. And the other one is what you got and what you administered. And you would see some people have administered quite well, others have not, because largely of vaccine hesitancy. Our position, if you look at the percentage of the population that was vaccinated, if you come back to the other slide, the first one, you would see a whole variety of differences there, and there are good reasons for the differences. You would see Barbados at 49%. That was that 100,000 vaccines they had got from India, which gave them a head start, because at that time they were in their main wave. And then, of course, you would see a lot of CARICOM countries, 20%, 35%, 24%. The smaller countries, the percentages are higher because it is easier to administer a small number of doses, and it reflects itself. But you see Trinidad and Tobago and Jamaica. Jamaica is at 7%. We are, at this time, it says 9% there, but we are more like 12%, because as of today, we are up just crossing about 12%. And of course, in the next 2 weeks, we would have not just crossed that, but we would have done completion, the second dosing of most of whom we had vaccinated. And I would like to ask the Minister now to take us into the numbers of what we have in hand, how we're going to use it, and what we anticipate to do into the end of January, in the end of June, into the start of July.
Thank you very much, Honorable Prime Minister. To my cabinet colleague, Minister Stuart Young, Chief Medical Officer, doctors of the medical team, ladies and gentlemen of the media, and the listening and viewing public, wherever you are, good Saturday afternoon. So we are going to give a review of the national COVID-19 vaccination drive, and this is how we will be reporting to you from now on. COVID-19 vaccine administration timeline, so you can see the journey that we are on. 17 February, we began the first dose of WHO-approved COVID vaccine, which was dedicated mainly to healthcare workers. Then we moved to April 6th, when we began administering vaccines to members of the general public for the first time. In May, we then second dosed those healthcare workers who started the ball rolling in February, because you have to have a 2 to 3 month gap. 7th June, we began second dosing for members of the public, which had begun in April 6th. Our national target at this time, all things being equal, this is goal 1. That will change as more and more vaccines come into the country. But this is simply based on what we have now and what is committed, will be to fully vaccinate with 2 doses 188,900 adults by July. Next slide, please. So what we have done to give the country a better assessment of how we perform across the RHAs and sectors. This is the breakdown by RHA, and you could go it through: Northwest, North Central, Eastern, Southwest, Tobago. Other state agencies, we started vaccinating particular ministries frontline, example, national security, energy, teachers, works and transport, and so on. And then under other agencies, we would have given doses to like the oil and gas industry, because you want to keep the oil and gas industry up and running. So total first dose to date, 150,692. Second dose administration by RHA, Northwest 2,367, Southwest, it's there, ERHA 535, Southwest 3,463, Tobago 313. So the total tally of second doses to date, 9,843. However, if you just go back, please, I want to echo Dr. Michelle Trotman's words. It doesn't mean that after you receive a shot, first dose or second dose, you are fully vaccinated. Dr. Trotman, it takes time for the vaccine, for your body to respond and build up the immunities. So you have to continue washing your hands, watching your distance, and wearing your mask. The public health protocols apply regardless of when you got your first shot, your second shot. Okay? Next slide, please. Moving forward, we have a special program now put in for the elderly. The system, an adjusted system, will be implemented from next week, Wednesday. So what was in place Thursday and Friday will no longer apply. That was inconvenient. So an adjusted program. Who is our target population moving forward? Vaccination for the elderly. And whom do we consider to be the elderly at this phase? Those 65 and over. The start date is going to be Wednesday, June 16th, which is next week, Wednesday. And the venue will be 36 health centers across the 5 RHAs. Basically 33 in Trinidad and 3 in Tobago. So let me repeat. This is an adjusted program coming out of what happened this week. This program will kick in on Wednesday. Not Monday, not Tuesday, but on Wednesday. Next slide, please. What is the process? So persons 65 and over, we are going to target you because we have in our RHA databases who is 65 and over, our hospital clinics. We do have some people 65 and over already on our database waiting for a vaccine appointment. We will be contacting you and asking you to come to the sites. So you don't have to come, you don't have to line up, you don't have to be inconvenienced. And we'll be setting up a special program for these elderlies when they come into our clinics. We have been targeting and have already started vaccinating residents and homes for the elderly. I want to thank publicly Ms. Carolyn Ruiz here, the president of that association. The last count I had, which is a couple days old, is about 750. They had initially asked for 1,000. So we have already vaccinated in homes for the elderly. These will be people, you know, in these long stay homes, about 750, which includes the caregivers who come to the homes, because they are the first barrier that you want. And then starting from Wednesday, we start to reach out to our shut-ins. We are going to you in your communities, in your homes, via our district health visitor program. So in this adjusted process, we are coming to you. A significant turnaround from what existed. And persons 65 and over, and this starts on Wednesday. So appointments will be given. The RHAs will contact their clients. District health visitors will contact and visit shut-ins to vaccinate. And the Trinidad and Tobago home will continue to schedule vaccinations in homes for the elderly. Right? So that is how we are going to be monitoring and evaluating and learning from the lessons of this week. Yeah. The next slide, final slide. Goal number 1. This is not the ultimate goal. This is the goal to be achieved in this phase based on what we have in stock. This is going to be a moving target as we get more and more doses in. So by July 2021, the goal, 1, is to have a totally vaccinated adult population of 188,900 of a population of 1.3 million. So that is going to be significantly above 10%. First dose administered to date, 150,692. So you can see the green bar is starting to catch up with the purple bar. And then fully vaccinated to date is 9,843. And that will start to move more and more each day as we vaccinate more and more persons with their second dose. So this is a very important slide. So the country knows what we are trying to achieve. What is the objective? The objective is, with our current supply of vaccines, to fully vaccinate 188,900 persons by July 2021, which is just about a month and a half away. Second dosing has already begun, and first dosing is going to continue. Okay? How do we intend now to utilize the shipment of vaccines coming in on Monday? What is coming in on Monday is 200,000 doses of Sinopharm vaccines. Now, let's go back. We started using 100,000, which was the original gift. It's a 2-dose vaccine. So 100,000 plus 200,000 gives you 300,000 doses. Divide by 2, it means I have to sterilize, or we have to sterilize at this point, 150,000 of that 200,000 for second dosing, which leaves us 50,000 doses to distribute of that batch that comes in on Monday. How do we intend to utilize that 50,000? The Supermarket Association of Trinidad and Tobago will be getting on or about 5,000 doses, give or take, again, in addition to what they got already. Trinidad and Tobago Manufacturers Association, somewhere again between 4,000 to 5,000 doses, in addition to what they have already received. The elderly vaccination program for the over 65s, we are going to allocate about 20,000 doses to them. Those are the most vulnerable, where we want to save lives. Supermarkets and so on is saving livelihoods. Tobago, I had a conversation with my colleague across there. They will be getting 3,000 doses. The construction sector will be getting 5,000 doses. Bankers Association, because they interact with the public on a daily basis, 2,000 doses. CPEP, another 2,005, bearing in mind we started with CPEP and some construction today, up at the paddock. And private security, they will be allocated 5,000 doses out of that tranche on Monday. So that will leave us with a little leeway, a couple $4,000 to $6,000 as contingency for whatever should arise. Balance, yeah. That balance will be a contingency. So that is how, that is the intention of how we use that 50,000 doses, which we will take from that 200,000 doses coming on Monday. Yeah. And the Diabetes Association, they will receive about 3,000 doses, again, give or take, for persons over 65. So we are targeting in a big way our elderly over 65 through the Diabetes Association and through our RHA clinics and through outreach programs, even though some of you may not be in our clinics. Moving forward, as we get more and more doses, we will make more and more doses available to other sectors. We want to engage people like TOP because they have a significant database of persons 60 and over, 65 and over. Okay, ladies and gentlemen, so that is a progress report on where we have been. If I could just go back to the last slide for the last time, I think it's worthwhile knowing, repeating the last slide, our objective is 188,900 fully vaccinated by July 2021 with our current stock. And we encourage every one of the 9,843 to spread the word to everybody else. Come out and get your second shot so that 2 weeks after your second shot, you could consider yourself fully vaccinated. Thank you, Honorable Prime Minister.
Thank you. I just want to mention that there will be some adjustments to some phased service from hardwares in the interim while we keep construction closed. That will come out tonight. It will probably be more than likely we will have some opening. We would rotate the days so that those people who have emergency arrangements and require small items in the hardware. But I want to make a comment at this stage. With construction closed and cement available in the warehouse, not being utilized in constructions, I would like somebody to explain to me what is the driving force for the increase in the price of cement. Because you see, a lot of people like to jump out in front, especially if they're going to land on the government with their hobnail boots to tell you what wonderful citizens they are. But in fact, they are leeches, and they are greedy, and they will take advantage of the sick, the aged, and the infirm. Because I have no understanding as to what has gone on to incur costs for any supplier of cement, with the result warranting an increase in the price of cement. I simply want to ask those hardwares who have cement, if you don't have cement, TCL should have cement to supply you. We have given exemptions to TCL to continue its business. So I don't know that there's any shortage or unavailable cement. We've given TCL permission to export its cement so we don't lose our contracts and our business. And instead of getting people walking in step with the rest of the country, trying to survive in a pandemic, there are people trying to dig out your eye in the pandemic. And I'm asking those of you who are buying cement, when you go to the hardware stores, to just keep a frown on your face. And if you are able to, have a conversation with anybody who is telling you about the increase in the price of cement. It is not right, and it is simply taking advantage of a bad situation. And I hope that we don't see any more of that. Because insofar as some of us are going beyond the call of duty, like our healthcare staff is, like there are other people in the national economy who are doing that. there are others who are seeing only opportunity to benefit for themselves. And that really upsets me. And it should upset you too. So tonight, we'll make some new arrangements for the shift operations of the hardware stores. And that is that's probably the only change we'll make. And don't forget that we are going in early curfew on the weekends for the rest of June. And hopefully, we stay this course. And I have confidence that if we are blessed by the Almighty, by the end of this month, we should be able to come out of much of what we are into at this stage and go into a July where we keep on vaccinating. I would like the minister to say a few words about the second dose in vaccine, because we keep getting things confused. There's so much being said that some people hear part of the conversation, didn't hear the other part. You said that nothing is happening on Monday and Tuesday. I don't think that's the whole story.
Thank you. So, yes, when I said Monday and Tuesday, it relates to the system we had put in for the elderly. That one has been adjusted and that one has been suspended. However, second dose Sinopharm vaccines started on Friday, and that will continue apace. So the vaccination program continues. First dose for ministries also continues, and second dose for AstraZeneca, which began already, continues apace at our 5 sites, the Paddock, UTT in Monroe Road, Sapa, Mayaro, and one other, Tacarigua Racket Center. The feedback from the second dose at those sites has been excellent. People are getting their calls to come in for their second dose. They are complementing the system, they are complementing the service. They are in and out in under half an hour. So the sites are working very, very well, and it's a major victory for us. So the vaccination program continues unabated for both second dose and in some cases first dose. What we are starting next week, Wednesday, is just a special program for our elderly over 65. Thank you, Honorable Prime Minister.
So at this stage, we'll take some questions from the media. Anthony is raring to go.
Prime Minister, you described Wednesday as a bad day, and you said the plan to promote walk-in vaccinations was a bad idea. Whose bad idea? What was the process that led to the decision-making process that led to this bad day? And do you still repose confidence in your Minister of Finance, in the Minister of Health?
Well, I thought all those questions were already answered. If I didn't have confidence in the minister, he wouldn't be sitting there. Secondly, I did say that we had a problem with the registration, and people were complaining that they were having difficulty getting through the registration system using the telephone, and an attempt was made to bypass that bottleneck by allowing people to come without going through the registration system. That solution created its own problem, and the problem was an overwhelming response. And I say, you want somebody to blame? I take responsibility for that, because it is a government decision. I'm head of the government. Okay? It didn't work, and it is not going to be tried again, and I try to explain to you why it wouldn't be tried again, because we don't anticipate being in a position to have enough vaccines to warrant that kind of open call out to come and be serviced at your behest. It has to be a managed arrangement so that we manage the population receiving the tranches as we get them.
Apparently there were people, lots of people in lines on Thursday. Lots of people over 65, some as old as 95, who were turned away from those lines on Thursday. Was Thursday also a bad day?
Well, Thursday wasn't as bad as Wednesday. And again, Wednesday flowed into Thursday. Was not discontinued. Because the communication to say what was going to happen on Wednesday obviously came late in the day on Wednesday. So the Thursday, Friday was a fix for those 2 days. We could have stopped it right then and there. But we still felt that we had some room to get some work done on Thursday and Friday. So we've stopped it now. And again, it is driven by an unavailability of vaccines. You haven't mentioned the attempt to use 50 vaccines in the health center. That in itself, it was an attempt to keep it going, but being restrained by the number of vaccines. Of course, it was dismissed on the grounds that what 50 vaccines could do. And of course, the response is so good and people are so anxious, thousands will come for these 50 vaccines. And basically, it was literally untangling a ball of thread. But we hope that when we start back on Wednesday, in fact, not just hope, we expect that when we start back on Wednesday, the difficulties we had Wednesday, Thursday, Friday would go. But what will arise from that? You see, every single decision we make, there's an action and a reaction. These vaccines are not enough for all of us, so we spread it thin. And the thinness allows those in this area not to get enough in your own area. If we had gone to one area and said, okay, as we got the advice, go to one area and use all the vaccine there and vaccinate those people and then keep them isolated and they won't experience the COVID situation and that part of the economy can go into the world. We got that advice from Tobago. We had people telling us who purport to speak for Tobago, use the vaccines we have, and because Tobago is a small population on island, vaccinate Tobago and make it. Had I done that, you would not finish accusing me of favoritism to my fellow Tobagonians. And the people in Pointe-à-Pierre and the people in San Grande will have an argument as to how could you? Now we say we will vaccinate the elderly because they are most vulnerable in the event that they get sick. I'm sure those who were exposed to the possibility of 60 and upwards from 60 who have self-declared NCD problems will say, but I think I am equally important. The little understanding we have to have here that whatever we do, there are going to be some dissatisfied people. But we have to do the best we can. And we have to be the most effective. Wednesday was not the most effective and it wasn't the best we can. But I regard it as one day in a year and a half.
Minister of Health, how do you plan to reach the 65 and over who are not in the clinics?
Yeah, so as the Honorable Prime Minister said, we simply don't have enough vaccines to go over everyone. So as I said, we'll be using the clinics. We have already reached out to the Diabetes Association. Many of their members are not in clinics. And then when we reach the position where we have more and more vaccines, we start to work with people like TARP. I have already reached out to my colleague, Minister Donna Cox, to get the list of people on old age pensions, 65 and over, and that is how we intend to reach them when we get more and more vaccines to vaccinate that population.
And I may say that I would keep persuading the ministry to operate the registration program still for those who can get in.
Yeah.
Right? And people who have elderly within your household, if you are not elderly, try and help those people to use what is there. Because the elderly at that age may not be using WhatsApp and not be using even the phone. But they have a cousin or a brother or somebody who can actually even bring them to an appointment. So the appointment system has some value, but it wasn't sufficiently robust to serve everybody who was trying to get in. But we shouldn't throw the whole system out.
Going forward, is the consideration of a mobile vaccination on the table?
Yeah. So the district health visitors are actually part of a mobile system. And as we get more and more vaccines, we will be utilizing all methods of distribution.
Prime Minister, I heard you say and it's been reported actually that 200,000 Sinopharm vaccines are due on Monday. But I also heard the Minister of Finance refer to the fact that Trinidad and Tobago had purchased 1.2 million vaccines from China.
These conversations, as I said a little while ago, and you might have missed it, some of these conversations are moving targets, and if you don't have the whole conversation, you could easily get misled. Let me tell you what happened with that million story. At some point early on, when we had no idea what was going to be the outcome of the African platform in which we were locked in with CARICOM, but not yet committed by contract and payment, we looked for the approval coming from the Chinese end, and they got the vaccine approved, Sinopharm, and we then got a source. If we get a million vaccines, Sinopharm, it's a 2-dose vaccine. That's only 500,000 people. We still have another 500,000 people to vaccinate. So when we didn't have any other possibility, we thought that we'll place an order for a large amount, 1 million, if we can get it, because it's still very difficult to get it. If we can get it, we give an indicative order. And of course, if you make a down payment on the indicative arrangement, then I say, well, I'm purchasing 1 million, right? But you have to make the full payment on 200,000, 300,000. But this is the business that's going on. But you know what I'm finding is that the more an uninformed person probes into the situation, the more you find things to be upset about. But you did hire some people to do the job for you, and that is the government. And rest assured that the public interest is being well looked after, and we change. For example, if we do get the 800,000 vaccines from the Johnson & Johnson brand out of the African platform, then another 200,000, and we handle 1 million people. Okay? So then we could easily say, well, what is happening with America and what is happening with difficulty with other sources of vaccine? We're out of that. But we don't know when and if. There's still a big if and when. Because even though we paid into that African trust, the initial payment, one has to be realistic. We are literally piggybacking with people who are having difficulty getting vaccines. So it is not a plain sailing that you paid in and you get 800,000 vaccines first in the line. I expect that the African population will continue to have difficulty getting vaccines, because that is what it is. I told you the last time, as we spoke about a week ago or 2 weeks ago, only less than 1% of African countries have been vaccinated. That is not going to change drastically in the next 2 to 3 months. People are talking about vaccination for the next year, and the American president talking about the next 2 years. We in Trinidad and Tobago are talking about breaking the back of our effort towards the end of the year. If we get a target of 500 to 600 people vaccinated by the end of the year in this environment where vaccines are hard to get, and it's painful, you know. I was up this morning very early, communicating with some people abroad. You know that there are vaccines about to be dumped in some countries in the next week? Millions of vaccines that are going to be expiring, which cannot be used, and they are likely to be dumped. But the way the world works is not flat. Right? We've made the case over and over and over and over. The only place we have not made this case, I can tell you, is at the Vatican. And we make that on our knees in our private business to God. But at the end of the day, we are hoping to come through this. And I simply ask the population in Trinidad and Tobago to use the official information from the official sources, because the official sources under this government are irrefutable, and they might not be a pleasant story, but it's the truth. I cannot stand here and tell you we can get enough vaccine to vaccinate the whole country in a month or two. In February, March, people are telling me, vaccinate the country, that's what you have to do. And I kept saying, the vaccines aren't available. And I kept telling you also that there are charlatans out there who will sell you vaccines if you are like that. And you would have seen Pfizer only last week telling a Korean mayor who almost lost 30 million, the value of 30 million vaccines multiplied by whatever dollar, they just see what was going on there, and said to him, we are not selling to third parties. There's no middlemaning. How much conversation in this country you would have heard about who has financier to get on, who is the middleman and the government? Please don't let those people upset you. Those kinds of conversations are simply meant to upset you. They don't contribute to the effort of protecting you from the virus or coping with the international environment where Trinidad and Tobago and Jamaica, we are having difficulty getting vaccines to protect our population.
Can you clarify how many Sinopharm vaccines we paid for and how many
so far?
Yes, so far.
Okay, let me tell you the Sinopharm story. We got 100,000 as a gift up front. We've paid for 200,000 in that batch. 500,000? Right, 500,000, of which we got 200,000, and therefore we could look forward in the not too distant future, which is a July story talking about, of another 300,000. That, if that goes according to plan, we would have used 500,000 vaccines. That means we would have given first dose and second dose to 250,000 people. And the thing about the Sinopharm, you have to give that second dose within a fortnight.
3 to 4 weeks.
Yeah, 3 to 4.
3 to 4 weeks.
You are changing dates to me, man.
No, man. No.
Dr. Parasam, what is the earliest? 3 weeks to 4 weeks. Good. So you can't hold it for too long, right? So that's what we just did. We used up the 100,000 that we had in hand as first dose, knowing that another shipment was on its way. If that shipment didn't make it, then we'd have only half dose somebody. And of course, Dr. Parasam could tell you the danger in doing that. But we got a second dose. 100,000 from this batch of 200 on Monday goes, 150 actually.
No.
100 goes to second dose. Those who got it from the 100,000. And then the rest goes into, we left with 100. So if we use the whole 100, it means that we have to get another shipment inside of a month. But just to be sure, we're going to use 50. And as soon as, by the time we're using that 50, we expect to hear when the other one is due. And if it is due on time, we use the whole 100. Right? So that's how you have to keep, that's how the numbers keep changing depending on what you're doing, depending on what's happening. If we, for example, if we hear now that we're going to get some vaccines coming from the United States, it changes the picture again. Right? And if, of course, the sellers open their door to make sales to people like us, then we could buy some. So these are options as we go along. So there's nothing unusual about speaking about 1 million from China, because that wouldn't get us further than half of it. And we know that we were involved with the African group, and if it came through there, that missing half could be dealt with from there. And of course, we're aiming to get the 800,000. And so, God willing, between those two streams, if nothing comes from the other source, then we would be able to go towards the target that we've set.
Can I ask a question to the medics?
Dr. Parasam?
Dr. Parasam, there was a report last night on television.
All right, 2020 or
Yes.
condolences to the family. Dr. Trotman actually had an update on that particular case, but go ahead and ask your question.
So the question is, according to the reports, the young man died quite suddenly. Of course, you all are very big on not disclosing people's medical business, quite correctly so. But the question is, has, is there a positive diagnosis of COVID in this case? And what would cause COVID to react or to act on a young man in such a very quick way?
Yeah, Dr. Trotman, who is familiar with the case, I'll let her answer. All right.
Thank you, Dr. Parsram. Again, condolences to the family. Always, when someone dies, it is very, very sad. When a young person dies, it becomes even more so. Unfortunately, this gentleman died and post-mortem was diagnosed with COVID-19. So he was not a case that was actually being followed along. Without disclosing particulars of that case, in general, people die suddenly from many things. And in this pandemic, sometimes COVID could be incidental and not necessarily primary. Without the benefit of a post-mortem, and which sometimes even with that, those details are difficult to elucidate. So whether or not this gentleman died primarily from complications of COVID or not is not something that we would be able to answer. In general, people who have COVID-19 can die suddenly. That's why, again, I want to implore that we all follow the public health measures. And we all, when it's time, respond to the call for vaccination to avoid that possible consequence. But people can suddenly have things like blood clots. The big word for that is pulmonary embolism, amongst a series of other complications that can come with COVID-19. Again, I would like to say condolences to the family.
Do you know if any tests for variants are associated with that case?
I'm not aware.
I don't know if the CMO will be able to say. We've been speaking a lot about vaccines, but what about booster shots?
So generally, I mean, the second dose is considered a booster, right? So with the vaccines we have in Trinidad and Tobago, the two vaccines, both of them require a booster at this point in time. So loosely, the terminology is a booster because it boosts your response in terms of immune response. I think the question you're asking is boosters beyond the WHO recommended boosters. For Trinidad and Tobago, so far, we continue to follow the WHO guidelines for each particular vaccine as it is given EUA or EUL. So for the two that we have, we follow the two-dose regime. Of course, as data comes to us in terms of how long that immunity lasts, there have been early reports that suggest most of the time from naturally or acquired immunity or even with vaccines, that it's giving us at least 8 months or a year and sometimes more with the existing regime. But of course, data will come to us as more time passes. And if a booster is required, let's say next year, for example, like what happens with the flu virus, we have to have a booster every year, then of course we will add that to our schedule as time passes.
Dr. Parsram, we saw the gatherings on Wednesday, Thursday, and Friday at the health centers. Sure. Are the health officials anticipating any sort of COVID spike in the next 2 weeks? And is the parallel healthcare system prepared to deal with that?
Well, I mean, whenever you have gathering, and we have said this, maintained this from the start, whenever you have gathering of people where social distancing is not there and masking is not there, there's a potential for spread. It requires naive people, meaning people who are not infected. It requires people who are infected as well. So there's a lot of factors that are unknown. When you look at the pictures from those days, you see that a lot of people were wearing the masks, which is a very good sign. But again, we have to wait the time. Let us see what happens in 2 weeks. If it does have an increase, again, it is sporadic gatherings in small localities. It's not all over the country. It was in particular health centers that it occurred. So we'll wait the time and see what happens. But again, with the mask wearing, it should mitigate some of the spread that could have potentially occurred.
But you know, there's another side to that story. And I'm told that if the cause for which you're gathering is a good cause, you won't get infected.
Prime Minister.
We have a holiday coming up, the 19th of June.
I didn't get your name.
Charlie Rampersad from Guardian Media.
Charlie.
We have a holiday coming up on the 19th of June. Will we be seeing the same measures that we had for the two most recent holidays?
Looks like it. Yeah, looks like it. We are working on that downward curve, and we'll take every opportunity to press it down, hoping that 1st of July we'll be in a different place, in a different space. Yes?
Prime Minister Terry and Brown Campbell from TTT News. As CXC...
Speak a little more loud, yeah.
Terry and Brown Campbell from TTT News. As the CXC exam approaches, many parents, like parents of art students, etc., who can't access things like the paint that they will need for the exam, and people who, children simply need something like a geometry plan, things like that, as these sectors remain closed. So there's a concern that, you know, exam is going to come up and they're not going to have what they need.
What I would suggest immediately is that that particular problem, I'm aware of it, and I think the way to solve that is to communicate with the minister for an exemption to be granted, so that that problem can be dealt with in a day or two. Right?
Is there any updates on the border closure or the border reopening?
We're still on track with that. That was, remember, go back to what I said, we're looking at second week of July, right? So we're still on track with that. As a matter of fact, the work has gone on. I was talking to the ministers this morning with Carl to lay out the framework. So that is on track.
And one more question for the Minister of Health. When we start this vaccination program on Wednesday, what numbers we saw 50 vaccines being given out on Thursday and Friday. How many vaccines will be given out daily at the health centers?
That will depend on the number of clients each RHA has, but we are allocating in this tranche about 20,000 doses for those persons 65 and over. So it's not going to be a fixed number per RHA or per health center. Okay?
Health Minister, Prime Minister said that we would not be...
If you just hold on 1 second, because I want to make sure that we're communicating clearly. We only have projections to use about 20,000 vaccines for that purpose. I'm sure we have many, many more than 20,000 people in that category. So understand from now, it is not everybody who is in the category that is going to get, because we just don't have enough vaccines. But on this go around, with the 20,000, we will have a smoother, clearer arrangement. And for those who didn't get called in this or was service in this group, in the next group, rest assured that we will come back to it again, because it is governed by the availability of the vaccines. I cannot stand here and tell you that 20,000 vaccines will vaccinate everybody over 65. And I'm not even vaccinated, I haven't taken mine yet.
Minister, can you clarify? Could you clarify? You said that the Ministry of Health is going to call people next week. Are those for the first doses or for the second doses?
Okay, thank you. So we are already calling people for their second doses. The program, which starts for the persons over 65 via the RHAs, will be for their first dose, right? So we'll try to accommodate as many of them as possible. And who is not accommodated in this round, as more and more vaccines roll in, we'll accommodate many more of them.
The appointment system created a lot of the chaos that happened last week, Wednesday, Thursday and Friday. More so Wednesday than any of the other days. Prime Minister is saying that we're not dismissing.
Let me clarify that again. The appointment system did not create that. The appointment system was not reaching everybody, because some people were calling and not getting through, but all the ones who were getting through and being positioned to be vaccinated were being vaccinated in a smooth way. But because of the complaints from those who were not getting through, a change was made to the system, and that change was come and get it first come, first serve, and that was a mistake. So it's not correct to say, and I said here this afternoon, I think the ministry should still keep the appointment system for those who get through it. It'll help you manage it. But don't confine it to that. That's what the minister is saying.
Well, that's what I wanted to find out. How are we going to fix or adjust the appointment system? Because a lot of people came out because they didn't get through, and it was sort of a open for all, as they interpreted it to be, that created the problem. So what, if anything, are we going to do going forward so that we won't have this repeating itself?
So, from Wednesday, so the RHAs are going to start to call people on their client base from Monday to come in, give them special times, appointments, and so on. We are working again with the Diabetes Association to bring in their membership in an orderly, sequential manner. So all of this is taking place from Monday. We will also, at the same time as the Honorable Prime Minister said, be relooking at the appointment system via phone, and in about 2 to 3 weeks, we hope to launch an IT platform. We already have it working on the back end. That is why the call-ins for the second dose is working so smoothly. We hope to now launch it on the front end, where members of the public can go onto the IT platform. When we are ready to launch that, we will see.
Any timeline to how soon that might be?
In about 2 to 3 weeks. It's basically using the same system that the Ministry of the Attorney General and Legal Affairs uses to make appointments and to do stuff for birth certificates and so on. We are working with IGovTT and the Ministry of Planning, Administration, and Digital Transformation on that.
Prime Minister, there is some allegations coming out of the Tobago handling. Allegation. Yeah. Well, I won't say allegation. The Auditor General's report into the handling of food cards in Tobago. Some discrepancies were highlighted in that, in terms of some people were getting food cards who did not submit their names, identification numbers, and these things. What, if anything, do you have to say to this?
I'm not familiar with the specifics that you're raising, but it wouldn't be the first time that food cards had a bad report from Tobago. There was one election where food cards were handed out from motor car trunks. But I'm sorry to hear that that is in the report. It must be that they're talking about. It might very well be that. But we have been tightening up on the food card system very much. But I can't hear this afternoon speak specifically to what you're raising specific to Tobago.
Minister, can I ask you, you referred to the increase in the price of cement. You referred to the increase in the price of cement.
Yes, I objected to it.
You referred to the people behind that increase as being leechers. You referred to them as greedy, taking advantage of the situation and digging out your eye. Yes? I just want to be clear that the company that put out the advertisement concerning the increase in the price of cement is a company called Rockhard.
No, I'm not talking about Rockhard. Rockhard Story, they are importers of cement. And their ad was very clear that they had influences that will cause them to want to increase their price. I am talking about price increases that have already been charged and paid by people who are here using cement. And I'm saying I am not aware that anything would have happened to the production of cement that would have generated a push factor to push the price up. I think it's just an opportunistic arrangement, and I hope that you would allow me the right to express myself.
Thanks for clarifying that, because it sounded at the beginning as though...
No. I mean, if Rockhard said they're raising the price because the price of shipping gone up, or price, I mean, we could query that, but at least that's a justification. I took issue with the local cement, which was already coming to hardware, or available with no increase from TCL. And I want to know what is it that would have happened to have caused the distributor to say that I have to increase the price. And the only thing I know of is because an opportunity arose to get a higher price. That is not a good thing for the people of Trinidad and Tobago. Thank you very much for coming, members of the media. Thank you very much for listening. And once again, I want to end by apologizing for what happened on Wednesday, but to give you the assurance that we're not leaving it like that. We work overtime. And finally, I want to continue to thank and recognize the sterling service being provided to Trinidad and Tobago by our health caregivers led by Dr. Parasram. Thank you very much.